On this episode, we're going to talk all about how to reshape your nose holistically. Now, this includes potential surgical options, non-surgical options, and even ways that people claim you can reshape your nose without any invasiveness at all. Do they actually work? All right, let's talk about your nose. Now, the nose is the focal point of the face. And when you really think about it, is anybody known for having a really attractive nose? I mean, think about it. There are celebrities who are known for having the best looking eyes, for having really nice lips, for having a nice jawline. But is anybody really known for having the most beautiful nose? Not really, because the nose is meant, honestly, to kind of blend in with the rest of the features of the face. And a nose that is an attractive nose is one that helps to bring out the other beautiful features of the face, like the eyes or the lips, or once again, the other features that I've mentioned before. And so when we do nose jobs, and I did nose jobs in my practice for 10 years, the goal was not to create a nose that people would look at and go, oh my gosh, look how attractive that nose is. It would be to create a nose that blends in with the rest of the face, yet still keeps their ethnicity and their individuality, but helps to bring out other features of the face as well. Because when the nose, let's say, is real prominent, it can draw attention to it, and it can cause it so that you may not notice some of the other really attractive facial features that are essentially put in the background because the nose draws up so much attention. And so like there are celebrities who have had nose jobs and it has really impacted how they have looked. And that can be a good thing. Ashley Simpson, Jessica Simpson's sister, who was a singer back in the early 2000s, had a very famous rhinoplasty. And afterwards, people said, oh, wow, she looks so much more attractive afterwards. But it wasn't that it changed, the other parts of her face more. It's just the fact that you didn't draw as much attention to that large bump that she had on the front of her nose. And so once again, changing the shape of the nose can really impact how the rest of the face is looked at. And the idea behind changing the shape of the nose, once again, is not that it's going to draw attention, but it's actually the opposite. So there are certain facts about the nose that I want to let you know about before we get into the different treatments. The first thing is, it is true that our nose does get longer with age. I see so many people as they get older and their nose starts to droop, it gets longer. This is normal aging of the nose. So the nose does not stay the same as we get older. And there's some people, as they get older, because the nose can get longer and a bit droopier, that will actually undergo surgery to alter that. There was a study it's one of the journals of facial plastic surgery that found that taking selfies will actually cause your nose to look 30% larger than it really is. I mean, when you think about it, 30% is a lot. So if you take a selfie with your phone, it is in some ways like a Carnival Funhouse version of your real face. Your nose looks bigger than it really is. This is different than if you take a photo from, let's say, 5 feet away. That's going to be a more realistic interpretation of how your nose looks. And so, it's kind of an interesting experiment. If you take a photo of yourself from really up close with a selfie, and then you take another one from far away, just take a look at how your nose looks. And I bet you're going to notice that your nose looks bigger on that selfie photo. So don't believe your selfies. Believe photos that are taken from farther away. That's going to be a more realistic interpretation of how your nose looks. Now, one of the things that we focus on as plastic surgeons is facial harmony and harmony of proportions. And there are actual scientific and mathematical analyses of the face where you can get certain areas of the face that you can split in half and in thirds and get very specific measurements. And there is a belief that if you follow certain types of proportions, that the person can be more attractive. And there was actually a plastic surgeon many years ago who wrote a book where he gave the quote unquote equation of beauty, where you took all these different measurements, you put in this equation, and it would spit out a number to tell you truly how attractive you are. And obviously, there's truth to that to an extent. And then part of it is kind of crazy, because there's beauty in all of us. There's so much individuality. There are people who have facial features that aren't quite proportional to their face, but are so attractive with them that I only think that you can take this so far. Because in the end, there's so much more to beauty than just plain facial symmetry. So much more to beauty. So much of it is how you carry yourself. So much of it is, your expressions on your face. And so really trying to bring it down into mathematical proportions. I think it's interesting as a plastic surgeon, but it's not real life. And so, and I mentioned this because one of the things that we notice when you look at proportions is the chin. Now, I don't do nose jobs anymore in my practice, but back when I did, one of the things I saw a lot were people who said, look, I don't like my nose because it's too big. And in reality, the nose wasn't that big, but maybe they had a recessive or a smaller chin. A smaller chin can make the nose look larger. And there are many patients where I've just done minimal work on the nose, but put a chin implant in them. And the facial harmony is affected such a way that everything seems to match better. And I have photos of these patients in my office. And whenever we talk about chin implants and stuff like that, I show them to them. And it's really marked what placing a chin implant or adding a bit to the chin can do in somebody who has a recessive, retrusive, or basically just a small chin. And so if you're thinking about getting, if you feel like, oh, my nose is too prominent, don't rush off and have a nose job. You really want to talk to somebody who can look at your facial proportions very objectively, and including the chin, because once again, sometimes it's not that your nose is big, it's that your chin is on the smaller side, and altering that can make a big difference. Now, I tell you, rhinoplasties is probably the number one most popular cosmetic surgery in Hollywood. I think the number one most popular cosmetic treatment is Botox. And that's an injection, obviously. I don't consider that actual plastic surgery. I think veneers are probably a close second to Botox. There are so many celebrities that have veneers, so many Hollywood actors and actresses. But when you're looking at actual plastic surgery, it's rhinoplasty. And there are so many celebrities out there who've had rhinoplasty surgery that you may not realize. And now, I'm not any of their doctors, but after looking at them, I believe that these celebrities have had rhinoplasty surgeries, okay? And some of these will surprise you, some of them may not. Michelle Pfeiffer. I think Michelle Pfeiffer, looking at the shape of her nose, it looks like she has had what we call a reduction rhinoplasty to cause it to be thinner and to reduce some of the bulbousness of her nasal tip. Julia Roberts, very similar situation. She also appears to have had a rhinoplasty. Beyonce and J-Lo both. I recently put a video out on my YouTube channel where I actually compare who had more plastic surgery, who spent more in plastic surgery, Beyonce or J-Lo. If you're wondering, take a peek at my video on my YouTube channel, because you may be surprised at what I think they've had done. Both of them, I do believe, have had their noses done. Obviously, I believe most of the Kardashian/Jenner sisters have gone under the knife for their nose. Some of them, you can really see the photos before and after. Kim and Khloe are two pretty big examples of that. The others may have also had nose jobs, just not quite as dramatic as Kim and Khloe's. And this is maybe a surprise for you. I think Ryan Gosling had his nose done too. I think that he had a bump taken off his nose. He may have had his nose straightened a bit. It's subtle. He didn't have a huge rhinoplasty, but I also think he may have had his nose done as well. Okay, so now that we've kind of gotten the basics of the nose and anatomy and proportions out of the way, let's talk about the various treatments that people claim can reshape your nose. If you go on social media, you may see people who claim that they have put clips on their nose. You see these, they come out of Asia all the time, claiming that wearing certain types of clips or clamps on your nose can reshape your nose. And the truth is that they just cannot. Applying a clamp to your nose, no matter how many hours in the day, is very unlikely to be able to change the shape of your nose. The reason why is because the nose is made up of bone on the top portion of the nose and cartilage on the tip and the nostrils. And although cartilage can warp and it can change shape, there's no evidence to show that that can happen after you essentially are an infant. So there are infants where we can actually do reshaping right after they're born of the cartilage of their ears. And that can actually help when a child, let's say, has a lop type of an ear or another type of an ear deformity. But there's no evidence to show that just physically trying to push on cartilage on the rest of the face can cause that cartilage to permanently reshape. So I don't recommend using those nose clips or any of that type of stuff. Once again, you can buy those super cheap on Amazon, but they are a waste of time and money. It's not going to work. Now, you may know that there is a celebrity, Alex Earle, who's one of the biggest celebrities on TikTok. She's a beauty influencer, and she claims that going on Accutane made her nose look thinner. A lot of people claim that she had a nose job, which once again, a lot of celebrities have. But she says that no, my nose got thinner after going on Accutane. And one thing you need to know about Alex Earle is that she is pretty open and upfront with what she does and her skin. She's had many videos where she has taken the makeup off, and you could see she's had definite acne issues. And so it's really, it's nice. It's a breath of fresh air to see a female celebrity especially admit to wearing makeup to cover up this type of stuff. So is she telling the truth about Accutane? Well, I think that she is. And many dermatologists have chimed in to say that they believe that she's telling the truth. So how does taking Accutane change the shape of your nose? Well, as you probably know, Accutane is a very popular drug to take for people who have cystic acne problems. Now, I don't recommend everybody take it. It really is for people who just have cystic acne that creates acne scarring, that is completely non-responsive to less aggressive treatments. So if you've done, the pads and the peels and the retinol and all of that, and it's not working, then Accutane is an option. The reason why I don't recommend Accutane willy-nilly for patients is because it can have toxicity with the liver. It can potentially cause birth defects. So you need to be on birth control pills if you're a female and you're on Accutane. And so really it's something that you want to be on for fairly short periods of time. It is very effective in improving cystic acne. And if you've just got, or somebody who's just got terrible cystic acne, then Accutane can be just absolutely incredible what it can do to clear up that type of acne. But once again, it does have its own side effects and potential risks. So that's something you always need to take into account. So how does it actually change the shape of your nose? Well, our nose is filled with sebaceous glands. And what Accutane does is it reduces the amount of sebum or oil produced by these glands. And when these glands go kind of haywire, you can actually create an increase in the size of the nose because those glands can cause thickening of the skin. As those glands then settle down, it's theoretically possible that it can cause the skin then to thin a bit. And that may be what you're seeing potentially with Alex Earle. Now, it makes sense. Did she also have a rhinoplasty? I don't know. I haven't looked at her nose that closely, but I do think that it makes sense that the Accutane could have changed the shape of her nose. Okay, so what else can you do to change the shape of your nose? Honestly, there aren't any other things really that I can think of that are going to change the shape of your nose non-invasively. So there are things that are minimally invasive that can change the shape of your nose, and the big one are injections. Okay, so what can you do to inject what we say a liquid nose job? How does that work? Well, in general, what we use to inject into the nose are fillers that can add shape to the nose, add structure to the nose. And so it can do things that can help to fill in the nose in ways that may be helpful for you. So, for example, if you've got, let's say, a dip in your nose, then it can fill in the dip and make the side of the nose, we call the dorsum, which is the front part of the nose that's usually straight. We can straighten out the nose in that way. If your nose is a little bit crooked to the side, then it can help to, if you add the filler on the side that it goes away from, then you can create the nose looking, you can cause the nose to look a bit straighter, but it's going to look a little bit wider. Okay. If, let's say, you want to actually widen the nose on purpose, if you've got an extra thin nose and you want it to look wider, then you can inject filler into the sides of the nose, and that can cause the nose to look wider. Or if you've got a nose that's kind of flatter than you want it to be, you can inject it over the top of the nose. We call it the dorsum of the nose, and that can add projection to the nose, making it stick out a bit more. So there are things that you can do very subtly with filler to change the shape of the nose, but there are also things that it just cannot do. So first thing is if you've got a large dorsal hump, which is a bump on the nose, no filler is going to make that bump go away. Now you can, with the smaller one, add filler on either side of that bump, and that can, that can to an extent make it look smoother and flatter. But if that bump is really big, unfortunately, filler is going to do the opposite. It's going to make it look potentially even bigger. If you've got a really crooked nose, if you've been punched in the face, if you've had a broken nose and the nose is way off to the side, filler's not going to do anything for that. Filler also does not narrow a nose. So if you've got a nose that is, let's say, on the wider side, let's say the bones of your nose are wide, it's not going to technically narrow it. Although if you add filler to the top, it may create the optical illusion that your nose may be thinner or narrower than it really is. If you've got a bulbous tip, if you've got kind of a round tip of your nose, nothing filler can do to change the shape of that. And then if you've got nostrils that you're not happy with, that too, filler doesn't really do a whole lot with the nostrils. If you've got, let's say, a nostril that's kind of retracted, then you may be able to inject a little filler that may make the nostril look a little bit bigger and more filled out. But other than that, not as much you can do with the filler. So what fillers should you use if you're considering doing that, and how do you choose the right doctor? Well, the first thing you want to do is you want to find a plastic surgeon who is an expert at rhinoplasty surgery. Okay, even if you're not going to have a rhinoplasty surgery, you don't want it, you want to make sure that if you go for filler of the nose, ideally you would see a doctor who does both, does liquid nose jobs and surgical nose jobs, because then you're going to be sure that that doctor is going to give you the most educated opinion of what you should do, and that doctor is not going to be, let's say, incentivized to go in one direction or another. So for example, if you have a rhinoplasty surgeon that doesn't do liquid nose jobs, that doesn't inject filler, then you're sure that that doctor is going to tell you to do surgery. If you go to a dermatologist, then they're going to not tell you to do surgery. Most likely, they're going to tell you to inject filler. So ideally, you want to see a plastic surgeon that does both so that they can give you their honest opinion of what's going to get you the result you're looking for. So that's the first thing. Second thing is you want to stick with a hyaluronic acid-based filler. And three of them that I would look into would be Restylane products, Juvederm products, and maybe the Teoxane products. The reason why it's important to use a hyaluronic acid filler for the nose versus, let's say, Sculptra. Sculptra may be okay, but more Bellafill, Radiesse, and silicone is because if the filler is accidentally injected into a blood vessel, or it's overdone, or you don't like the result, you can inject an enzyme that can melt it away almost immediately. Now, that's nice because if you have silicone, Bellafill, or Radiesse injected into your nose and you're not happy with it, then you just have to wait it out. If Radiesse will go away within a year or two, but Bellafill and silicone won't, and you're just kind of screwed. Like, you got to stick with the result you got because it's really hard to take that out, especially without cutting your nose open. And so going with an HA filler, Restylane or Juvederm are the two most popular. That's what we carry in my office. That's really the way to go if you're going to have your nose injected. Because once again, if you get that complication, you can melt it away. The other thing that you have to be aware of with liquid rhinoplasty is that there are certain blood vessels that go through the nose. And if the doctor accidentally injects a filler into those blood vessels, you could kill off parts of the nose and you could even go blind. Yes, people have gone blind from injections of filler in the nose. I've never seen it, thank God, but it has happened. And so you just want to be really, really careful. So what about, I mentioned Sculptra, and what about fat? Could you use Sculptra in the nose? Sculptra you could use in the nose. Sculptra is fairly safe because essentially it's just some powder mixed with water. As long as it's not too dense, that could be a way to add a little bit of volume to the nose like an HA filler. Fat is interesting because, I spent a year out in Beverly Hills, and this was before we really had many fillers. And the plastic surgeon I worked with out there, he did inject a little bit of fat into people's noses and would always claim that what would happen to that fat is it would end up feeling like essentially nose. I haven't seen enough of them to verify that this is the case. Now that we have all these fillers out there, I don't recommend using fat for your nose, but that has been used in the past by doctors. Just, it wouldn't be my top choice. And then the final thing, if you're going to have your nose injected with filler, ask your doctor if it's possible to use a cannula. Cannulas are essentially blunt tip needles where you're going to have less of a risk of intravascular injection, of injecting that into a blood vessel with a cannula than with an actual needle. And so if they can do it with a cannula, that's best. Some parts of the face, you have to use a needle. A cannula just won't work. But talk to your doctor about that if you're going to have a liquid nose job. So that's kind of the gist of the liquid nose job. It's limited what you can get from it, but those results can last a couple of years depending on the filler that they use. And depending on your issue, can be potentially very helpful for you and help you avoid going under the knife. All right, well, now let's talk about actual surgery. So rhinoplasty surgery is an operation that I trained to do in all my 5 or 6 years of plastic surgery training. I ended up working in Beverly Hills with a top revision rhinoplasty surgeon. This is a plastic surgeon that does a lot of fix-up nose jobs. And in my practice, I did nose jobs for the first 10 years in practice. So I did a lot of them. But I tell you, I hated doing them. Rhinoplasty is arguably considered the most difficult operation in plastic surgery, not because it is labor intensive, not because there's such a high risk of bleeding or complications with it, but when you make one little change to one area, it can cause another area to change. When you take down a bump, sometimes the cartilage can grow back. When you remove cartilage to thin the nose, sometimes you can get scar tissue that builds up there, making it look like you didn't do as much as you thought you did. And the whole nose can swell up and can take a year for the swelling to come down. And so because of that, rhinoplasty surgery, it is just tedious. And the follow-up period is tedious because it takes so long for the patient to get their result. And even though you may have a great result on the operating room table, sometimes it doesn't heal that way. Cartilage can warp. Things can drop a little bit. It's like there's so many little things that can go wrong or can change with the operation that I found it just frustrating. Now, I thought that I had great results with it. My patients were very happy. I did very few revisions of it, but I just never loved doing the operation. And it's interesting because really when you look at it, the nose is just composed of a handful of bones and a handful of cartilages. That's it. You know, it's not that, it's not like you've got all these bones and cartilages you have to deal with, but it's just the fact that you make one change and other things can happen that can be very, very frustrating. The other thing you have to keep in mind, I mentioned earlier that you can get scar tissue that builds up after the operation, and this can happen with all nose jobs. And literally 1 millimeter of scar tissue can be visible from a normal speaking distance. So you talking to me in a normal speaking distance, if you've had a nose job and you just get 1 millimeter of scar tissue that created a little bump there, I will be able to spot it, which is frustrating. Okay, so there are two ways to do a surgical rhinoplasty. There's the closed technique and the open technique. Each plastic surgeon will choose what they feel most comfortable with, and some plastic surgeons feel comfortable with both. Now, when I trained at Michigan State University as a resident, we did all open rhinoplasties, and that was how we taught. And in an open rhinoplasty, basically you make an incision on the inside of each nostril, and then you connect that incision across your columella, which is the skin that covers your nasal septum. And so by making those incisions kind of from one nostril all the way across to the other, it allows you to literally flip the nasal skin up off of the cartilage of the nose, of the tip of the nose. And so then you can then reshape the cartilage when it's right in front of you and you're looking at it. The problem with an open rhinoplasty is, number one, you get an extra scar across your columella, across that skin over your septum, and sometimes that scar can be visible. And number two, you can get more swelling that takes longer to go away with an open rhinoplasty. But the benefit of an open rhinoplasty is that it's easier to make changes to the shape of the nose than with a closed rhinoplasty. In a closed rhinoplasty, and that's what I learned how to do in my fellowship, you make two incisions, one on the inside of each nostril, and all of the work is done underneath the surface of the skin. So from the inside, you can cut out cartilage, you can reshape the tip, you can take the bump down, you can break the nose in, all through incisions on the inside of the nose. The benefit of doing that is no extra scar for the patient, and you'll get, in general, less swelling. The negative is it can be really difficult to make certain changes to the nose. If you're doing a closed rhinoplasty, it's not that hard to take a bump down, to narrow the nose by breaking it in. It's not that hard to reduce a little bit of a bulbous tip. But if you're trying to do more things, then it can be a more difficult operation. And so for me, I learned how to do the open rhinoplasty when I was a resident. When I was a fellow, after I finished my residency, we did all closed rhinoplasty. And so in my practice, I did all closed rhinoplasty for 10 years. But I limited myself, and I wasn't doing these huge reconstructions. It was mainly, hey, let's take a bump off. Let's make the tip of the nose less bulbous. Let's narrow the nose a bit. And just those kind of basic stuff that with a closed rhinoplasty can be very, very easy. Now, also, if you're going to have a nose job, a couple of things to keep in mind. While you're in the OR, some doctors will actually straighten your septum. So if you've got breathing issues and you're going in to reshape your nose, then they can actually help with those breathing issues. You have turbinates, which are these little bones that kind of go into your nasal airway to actually moisturize the air as it comes through. Sometimes those turbinates can get swollen. Sometimes they can kind of be in the way, and they can cause airway obstruction. And so sometimes what you can do is actually break those turbinates or even remove portions of it. And that will allow people sometimes to breathe a little more freely. And then how is it after surgery? Well, oftentimes we'll need to break the nose in during the operation. And the reason why we do that is to try to narrow the bones after, let's say, you take off a bump. And so the way I describe it, it's kind of like your nose is like a pyramid. And when you shave the bone off, you turn it into kind of a trapezoid, and you make it flatter on the top, but it can look wider. And so by actually breaking the nose in, what you do is you break it in on the sides and push it in, and that causes it to become essentially a pyramid again. And so breaking the bones, though, almost always gives you black eyes afterwards. And that's one reason why you see people who've had nose jobs and they have black eyes afterwards. Most of the time, you'll wear a splint on top of your nose, and oftentimes, especially if the nose is broken, or especially if you do septum work, you'll get packing on the inside of your nose as well that stays in for a good week or so. And so for the first week after a rhinoplasty, most patients cannot breathe through their nose. So you're breathing through your mouth. It's kind of uncomfortable. You're all stuffed up. You know what it feels like to be stuffed up when you have a cold and can't breathe through your nose. It's so not comfortable. That's the same thing kind of with the nose job, but you also have the discomfort of the fact that you just had your nose done. That doesn't feel so good. And then swelling can last anywhere from 6 to 12 months. The nose keeps swelling longer than almost any other part of our body. And I think one reason why is because the nose just doesn't really move. Because it doesn't move, the fluid sits there and just doesn't go away. And it can take literally a year to get the final results, especially if you have an open rhinoplasty. And what that means is that you may feel like your nose is quite big and swollen for a long, long time. It is tough. Now, I did most of my nose jobs closed, actually, I think all of them in practice, and I didn't get a lot of swelling because of that, which was nice as a doctor. But man, when I was in residency and we were doing those open rhinoplasties, and people be 6 months out and you're still holding their hand saying, just give it more time. It's going to get better. It's going to get better. You have to be patient if you're having it done, especially with the open approach. And you want to keep in mind, if you're thinking about a nose job, and this is one reason why I stopped doing them, the revision rate is the highest really probably in all of plastic surgery. And studies show that the revision rate for rhinoplasty in studies is about 10 to 15%, meaning that 10 to 15% of patients who had nose jobs went back to try to get it refixed up because they were unhappy or something happened. I believe that number is probably closer to 20% or even 25%. And the reason why is because these doctors will put their information out there, but they may be some of the best doctors because they're writing papers on rhinoplasty surgery, that they may be having a lower revision rate than the average doctor. My revision rate was super low, but it was also because I was very careful in what I did in choosing my patients right. And if I didn't think I was going to get them the result they're looking for using my techniques, I was happy to refer them to other doctors. And so my revision rate going through practice, it was less than 5%, which, man, I was really proud of. But when you get to that situation, you have a rhinoplasty revision, it's tough because they've already got scar tissue. You're going to reoperate again, create more scar tissue. And you're always worried you're going to get into that situation where at some point, if you have 2, 3 nose jobs, it starts becoming diminishing returns. And and you start actually getting a nose that gets scarred up and looks worse than possibly your first result. And so you got to be careful. If you're going to get your nose done, don't do it more than twice. If you're getting a nose job for the third time, then most likely that's a mistake and you're going to get scar tissue buildup and it's not going to look good, or you're going to have issues with that. And so it's always best done the first time. And so just make sure, if you're thinking about rhinoplasty surgery, to see a plastic surgeon who does a lot of them, who spends a lot of time with you going over the operation, so that what you envision in your nose and what this doctor envisions the nose looking like is going to be the same. Okay, you've got to make sure you're on the right wavelength with this with your doctor, so that what you want to get is the same thing that they're trying to get for you. And keep in mind that even if they do all the right stuff, you can get swelling, you can get cartilage warping, and these things that can go wrong. So that's the issue with rhinoplasty surgery. So I hope this was helpful for you. And just keep in mind that there are a lot of ways to kind of skin the cat. Unfortunately, with the nose, it's typically injections or surgery. Injections are limited. But hey, if that works for you, then by all means do that. Always remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.